Well, joining us now is Mikey Erhardt, who is the policy lead at Disability Rights UK. Great to have you with us. Look, Mikey, I'm really aware that we've spent the programme talking a lot about the politics of this, about whether Keir Starmer's authority's been impacted, about whether MPs are going to vote for it. And we really do need to talk about the impact of the actual policy itself on people who could be very worried about it this evening. What is your reaction to what we've seen and, of course, that big concession from the government too?
Evening, Sophie, and thanks for having us on. And you're right, like, policies don't happen in a vacuum. We're not numbers on a spreadsheet. This is people's lives. And, you know, MPs tonight still voted to make big cuts. There will still be hundreds of thousands of people affected by the changes to universal credit that were in the bill. Our reaction of disabled people, as you saw at the protest, and I know organisations like mine, is deep disappointment. And not just disappointment at the substance of the bill, which we still have lots and lots of questions about, but at the pure chaos and mismanagement that we've seen. A lot of this process has led to disabled people trusting even less that the DWP and the ministers in charge of it, that we can trust them, that they know what they're doing, that any reforms moving forward will actually listen to us. We
have heard an awful lot from ministers recently, actually politicians, to be honest, from all parties, saying that the rise specifically in kind of PIP claimants, in disability and sickness payments is unsustainable, that it's gone up so much through COVID that it just can't keep rising. Do you recognise that argument?
I think the first thing to remember is the wider picture of how much we spend on the benefit system at large. Our sort of payments on working age benefits has been stable since 2008. It's 5% we spend in total on the benefit system. That hasn't changed. These cuts, the $5 billion that were proposed last week, would have taken that further down, right? We're not in a position where we really have anything like unsustainable benefit spend. And if we're thinking about cost realistically, those $5 billion that were proposed last week, they'd have saved £100 million, because we know, you know, when you take money out of the benefit system, all you're doing is pushing costs around the system into local authorities, into the health service, into out of local communities, because people spend their benefits in the local community. Not saving money by making cuts. All you're doing is putting costs elsewhere.
Mikey, thank you very much indeed. It's been a short live, we're kind of out of time, but it's been great to get your perspective and really important to hear those arguments that you were making. So thank you very much for coming on the programme as well.